Hi, hello, this is again Dr. Ijaz Pasha here. You've been watching us and appreciating our videos, and thank you for your responses. And as I've been here since 26 years, now we would like to give you an information on what is more happening about the implants and the bridges. Why do you need to go for a bridge or an implant? Before we go for it, we need to understand what is a bridge and an implant. As far as bridges are concerned, we have given already in the previous videos. Okay, now I'll just show you. A bridge is something which we take support from the adjacent two teeth. For example, if you have lost one tooth, we take support from the adjacent tooth. Now, what is those adjacent teeth? What is the percentage of function that has also been covered? But still, I would like to tell you on this. We normally take 4 teeth as our chewing teeth, with is 2 premolars and 2 molars. Now each tooth, like how we have each finger, we have its own function and the capacity. Similarly, most of them do not know that each tooth has its own function. Particularly the chewing, you see premolars, 2 premolars has got 5% each, whereas the first molar has 80% in chewing capacity, whereas second molar has got 10% in chewing capacity. So now, as you see, these 4 teeth are important in chewing, whether it's right or left or in the upper or lower jaw. Now that's about the importance and the significance of each tooth. So imagine you are taking a support where you have lost one, say 80% tooth, then you are putting a load on the adjacent, that is front and the back, which is 5% and this is 10%. Now what is happening here, your 80% load is divided as 40 and 40 on the front and the back, and that which can take up only 5% has to bear another 8 times extra, that is 40%, whereas your back tooth has to take 10%, which takes up the load, has to take another 40%. That means 4 times extra. That is where the bridges do not survive for a long time, because you are basically doing the over engineering work, or you are doing an over expectation work where by nature a tooth can bear to that particular chewing capacity which I mentioned earlier. Now, what does it happen? Your bone starts getting reduced. So this is what most of them do not know. The bone which is there, say for example 2 centimeter, once you wear a bridge, every year 1 to 2 millimeter your bone starts reducing because of the bridges. Now that is where the implant comes into action or into picture. Now implant is nothing but something like a pillar which replaces the root part of your tooth. You can see over here, this is something which you see commonly in the clinic. So this is something like implant, we call it, or this is an implant where it replaces only the root portion of the tooth which we are placing. Now what is the other things? They are called as prosthesis for fixing a crown or the cap. Now coming back here, I would show you here in this, you can see there are 2 implants here. Similarly, I can show you another single implant here. Now over this we fix the tooth. Okay. Now whether you have 1 implant or 2 implants, now we take a decision in conversation with the patient according to the space and all those things. So what is important here is implant. What is the survival? Now survival has got years together depending on the medical condition. Now, as I said, if you go for a bridge, it is 1 to 2 millimeter per year, whereas implants, it is 0.1 to 0.2 millimeter. That is 10 times better than your bridge. This is where the difference between the implant and the bridge comes into picture. Now, I hope you understand this, and for more information, you can call us at our clinic number or you can contact us. Thank you.